And with that, initially we were going to have Amy speak, but I guess I'm going first. I just want to first show this slide of the late Dr. Quentin Young, who many of us were so inspired by. He is somebody that I actually met when I was an undergrad at the University of Chicago back in the 80s. He, as many of you know, was a tireless healthcare activist. He cared for Dr. Martin Luther King as well as President Obama, and he passed away about a year and a half ago. But one of the things I just want to mention about Dr. Young was he said, over the years I've aligned myself with unpopular causes. I've worked to replace the worship of the market with concern for the common good, social justice, and tolerance. Over time, the American people generally do the right thing, and I'm confident they will see the national health insurance is no longer the best solution, it's the only solution. And he said this, almost 20 years ago. He was a man that, at the age of 77 back then, in 2001, went on a nearly 170-mile walk through the state of Illinois, advocating for universal health care. And he is somebody that, as I mentioned, took care of Dr. King. And he also helped launch the Medical Committee for Human Rights, and that was really designed for doctors who were really there to assist any people, freedom marchers who were hurt during their marches or protests, and really be the medical triage support system for him. And as we all know, he was actually the person that actually recorded this quote by Dr. King, who spoke in 1966 when he said, of all the forms of inequality, injustice in healthcare is the most shocking and inhuman. And so we've kind of come full circle, and I want to just keep this in mind, that there you have Dr. Young talking to Senator Sanders. Now, many of you in this room have been lifelong single-payer activists, and I think many of you remember prior to his presidential campaign how we were sort of viewed as a fringe element, right? That many times we were not taken seriously, many times we were either ridiculed or quickly dismissed. Very few elected politicians would bother to take time to even talk to us. But it was really, I think, through Senator Sanders' presidential campaign that elevated the whole concept of Medicare for all into the public consciousness. And it is here to stay. And not only that, very much like marriage equality, it's starting to become more popular in a very exponential way. So I'm an oncologist by training, radiation oncologist for 20 years, and really about 4 or 5 years into practice, I started to see so many of my own patients going bankrupt strictly because they developed cancer, and that's where I started to realize that our whole system, there was something desperately wrong. And Senator Sanders was speaking from my heart when he said in the United States of America, you should not be forced into bankruptcy strictly because you were diagnosed with cancer. But this is still the problem. This was a study that came out just in August, so just a month and a half ago, by a doctor at Duke University who also is a radiation oncologist. She is actually somebody who's lost her husband 5 years into their marriage of a devastating cancer, bankrupted them. She decided she was going to go back to medical school, become a doctor as well as health policy, and she found that 1 out of 3 people with cancer face out-of-pocket costs that were greater than expected, and many of them run into significant financial hardship. And this is just showing you the number of people that go bankrupt in the United States. It varies from the low estimate, some people say 600 to as much as 1.2 million people each year, which should be pointed out that the majority of people who go bankrupt are actually insured. It is not necessarily the uninsured, but it's actually the insured. And one of the things I just want to point out is there's this whole idea that somehow most of the people that go bankrupt are older, but this is showing you that particularly between the age 35 to 55, that's where the majority of people who get sick and go bankrupt reside. And one of the things that with Sanders' plan, and I'm sure somebody will talk more about that, is there's this 4-year graduation sort of implementation where they will first start with people less than 18 years of age and over 55, and then eventually expand this. But I would argue that if you look here, the 35 to 55, that's a big percentage of the people that go bankrupt. So this is a real urgent problem. And just, I want to ask you to focus on the column on the left, which is people with insurance. what it says that 34% of the people who actually get sick report being unable to pay for food, rent, or housing. And these are people with insurance. And how is this happening in our society? So when Dr. King made that statement about our healthcare system in 1966, here we are 51 years later, and the problem, I would argue, is worse today than it was back in 1966. This is also showing you that the number of adults with medical problems have lingering financial problems. And the column I would ask you to look at is the orange middle column, because that is, again, in the insured. And if you look at the second one, 47% report using up all their savings when they get sick. So it makes you wonder, what good is insurance if it's not going to protect you from the things that are happening? Yep. Just to point out that this was something that Senator Sanders mentioned, that we do spend nearly twice as much as any industrialized nation. This is showing the percentage of our gross domestic product that we spend on healthcare compared to all the other industrialized nations. And what do we get for that? We are, by every metric, the worst performing healthcare system in the world among the industrialized nations. We have a higher infant mortality and a lower life expectancy. And one of the things that you'll hear, don't think that because today is the 30th and the GOP couldn't get their bill passed, that they're not going to continue to try to introduce free market privatized solutions over the next few years, whether it be trying to privatize Medicare or convert block grants for Medicaid. It gets back to this whole free market versus socialism argument. And these are some things I just want you to pay attention to. So where did the term socialized medicine come from? This is California's contribution, sadly. Back then, before Ronald Reagan was a well-known actor / politician, the American Medical Association hired him to record this album. And this was in opposition to Medicare. And the idea was they wanted doctors' wives to have teas and play this album, and everyone could listen to Ronnie sing about how Medicare was anti-freedom. And what he said in this is, if you don't stop Medicare and I don't do it, one of these days, you and I are going to spend our sunset years telling our children and our children's children what it was once like in America when men were free. Right, so this is the whole concept of freedom and healthcare. And it started back with Ronald Reagan and the American Medical Association. And in the run-up to the Affordable Care Act, I was debating Ron Paul. And what did he say when I said we needed single payer? He said, no, we need more freedom. So let's talk about freedom for a second. This is from the Conservative Heritage Foundation, looking at economic freedom scores from 2015. And if you look, every country that's ranked ahead of the United States in terms of economic freedom, what do they have? Universal health care. So the idea that somehow universal health care is the antithesis to freedom, I would argue, is not true. Matter of fact, not having universal health care or being tied to your employer-sponsored health care is a lack of freedom. You're stuck in your job. You can't go switch your job, right? So one of the things you hear from the private sector is that any universal health care or government health care is going to be a job killer. Well, this is the Affordable Care Act. And look, we all know it was not all that. But just to show you that from the time it was implemented to now, what have we had? Consistent job growth. This has not been a job killer. And the idea that somehow single payer would be a job killer is completely ludicrous as well. So let's talk about the effect of healthcare on business. This is just from 2008, but what it was showing is that that General Motors at one point was spending more on healthcare for its employees than it was on steel to make cars. And then it's so much so that Charlie Munger, who is the Republican vice chair of Berkshire Hathaway, just came out a few weeks ago that said medical costs are the tapeworm of American economic competitiveness. He called it a cockamamie system, which gives our companies a big disadvantage in competing with other manufacturers. They've got single-payer medicine, and we're paying for it out of our company. And he came to the conclusion that single-payer is the way to go. And this is the point. We're seeing a sea change, not just among progressives, but among smart business people, and I'll show you some others as well. So one of the things you hear about is let the free market rule. Well, there is no free market in healthcare. And there are only two industries that are exempt from antitrust legislation: Major League Baseball and the health insurance industry. And what you'll find in most major cities and now in most major exchanges, you have one or two insurers that dominate the market. Alabama, 90% of people who have insurance have Blue Cross. And let's talk about individual freedom. It's not the government that's constantly getting between you and your patients or you and your doctor. It's the insurance industry that constantly inserts itself in the middle of this and takes away all of our freedom. And at least in California, over the last 9 years, there have been close to 50 million denials of claims over that period of time. What's even more sinister about this is, I think it was CNA that did the study that Dave Ignatius had pointed out, that if you are tenacious enough to fight with your insurance company to get a denial overturned, if your doctor is willing to spend hours on the phone working up with case managers, 50% of those denials get overturned. What does that show you? That the insurance industry is automatically denying things they know they shouldn't be, but they're also banking on you not fighting for it. And this is one of the things that's making our healthcare system so inefficient. The amount of time that we're wasting fighting with insurance companies, both as a provider as well as a consumer, that should otherwise be used to actually take care of patients and get on with our lives. So one of the things that you'll hear is, well, you should be able to directly negotiate your care. Well, if you're having chest pain and you need bypass surgery, good luck trying to negotiate finding a cardiothoracic surgeon, then finding a hospital, an anesthesiologist that's going to do that, a CCU. But this is just showing you, and this is from 2012, what an average bypass costs in the United States, $150,000. So how are you going to negotiate this, or if you have a ruptured appendix, in a timely fashion? So the idea, you can negotiate maybe Botox for your lips or something like that, but not crucial health care. So the idea, again, of freedom and doing this, simply just not practical. So just so you know that insurance rate premiums, this is for California, but I'm sure nationwide in your states it's very similar. They've continued to skyrocket, right? Do you know any other industry other than maybe the military-industrial complex and the prison-industrial complex that is recession-proof? No. So the health insurance industry continues to raise rates. Meanwhile, wages have continued to decline or remain stagnant. But these guys' wages don't remain stagnant. This is showing you the average compensation for the CEOs of the big insurers. In 2016, the average salary was $43,000 in the United States. Many of these people were making 2-3 times that a day. And this is on the backs of denying us. And what do they do with this money? They turn around and they buy off our legislators. And that's why in the run-up to the insurance, the Affordable Care Act, there was no insurance rate regulation and no pharmaceutical drug pricing controls. Now, the Affordable Care Act did do some really good things. It lowered the uninsured rate to the lowest it's been in a long, long period of time. 23 million people gained access to health insurance. Doesn't necessarily mean they got access to care, but they, quote, have insurance. But we didn't do away with these pre-existing conditions. And I just want to say that the Republicans, they're not going away, as somebody mentioned. They're hard to kill. But one of the things they say is they're pro-life, but that's until you're born. And then once you're born, they call you a moocher. And this is the reality of their ideology. So let's just talk a little bit about the Affordable Care Act. It's one of those things that looks good from afar, but far from good up close. As you know, even with the Republican repeal, which we should all applaud ourselves for defeating, there's still 29 million Americans that are uninsured. What's really criminal to me is the number of undocumented brothers and sisters who were left out by both Republicans and Democrats. And then you have the states that failed to expand Medicaid and such. In California, we have 2.7 million uninsured, of which 250,000 are children. So I just want to point out one verse from the Bible, because the right wing always likes to cloak themselves in the mantle of their faith. And they like to use the book of Leviticus to slam and condemn gay marriage, but just one page over, it says, "The foreigner residing among you must be treated as your native born. Love them as yourself, for you were foreigners in Egypt. I am the Lord your God." So just so they need to understand what book they're reading, this is in there as well. Now, what happens is hospitals, and it should be pointed out that our undocumented community, they pay taxes. They pay billions of dollars in taxes. But as a result, they don't get health care. Many times they will present to hospitals with later stage diseases. Many times it's then uncompensated care. And this is the excuse that hospitals use to jack up prices. And this is just showing you that California Pacific Medical Center in Northern California, what they charge for an echocardiogram, $1,700. Where they charge for Tylenol with codeine, $36 compared to 50 cents that you can get it. But this is all under the guise that they need to do this to pay for uncompensated care. This is just showing you the average amount. It varies from parts of the country in terms of how much it costs to get your cut finger fixed up. In the West Coast, California, it's $1,300 to get your fingers stitched up. And again, they are jacking up these prices because they say we need to pay for uncompensated care. So let's talk about this. If you look at the, quote, non-for-profit hospitals, they are actually the most profitable in the state of California and in our country. Yet they only provide 4.7% of uncompensated care. So we need to look at everything, not just reforming our single-payer delivery model, but holding these, quote, not-for-profit hospitals for task as well. And I just want to mention one thing about Kaiser, because in California, Kaiser insures 1 out of 3 people with insurance. They do a great job. I have friends and colleagues who are physicians there. But they also, for quote, a not-for-profit, sure make a ton of profit. This is just showing you the amount of money that they've continually gained each quarter. And in 2015, they had over $20 billion in reserves, which was more than 1,600 times what was needed by the insurance regulators in terms of what they needed. And they've developed a venture capital vehicle through Kaiser. And one of the things that they've done is they've actually invested in a for-profit janitorial service and laid off janitors in Vallejo and South San Francisco and replaced them with this for-profit. So what are they doing with all this money? They are actually the biggest lead health lobbying person in the state of California. And as you know, we had a proposition in California to regulate insurance rates. And this is just showing you how much that they donated, $18 million towards defeating insurance rate regulation. Why does a not-for-profit need to care about how much that, their insurance rates are being regulated? Right? But this is the dark influence of money in our society that's paid for by us every time we pay a premium. So as a result, because of that, we don't have insurance rate regulation still, and now, after the Affordable Care Act, this is going from 2015 to 2017, 37% of people now report having difficulty paying their monthly premiums. And on the right-hand side, 43% have report having difficulty paying for their deductibles or copays. And I just want to talk about one thing, which I'm sure many of you know, the Bronze Plan, which should be really consumer fraud. And it's just showing you the standard benefits. And what it is it basically covers 60% of your all costs. Now, most of the people that are getting a subsidy, this is the plan they choose because even with a subsidy, they can barely afford to buy this plan. But what happens is these plans are a scam because you have to pay the first $6,000 or $6,500 out of your own pocket before insurance kicks in, and when it does, then it only pays 60%. So if you feel a lump in your breast and you don't have a couple $1,000 sitting around, you're out of luck. You're going to delay seeking care. You're not going to go see a doctor because you can't afford even a mammogram. You can't even afford the ultrasound or the biopsy or anything like that. And this is the scandal of our healthcare system. It's still a big scam. I'm just going to fast forward a few things just to point out that without the Affordable Care Act, why we're fighting so much for single payer in the state of California. Premiums are going to rise on average on the exchange 12.5%, although Anthem announced that we're going to raise rates 35%. And also in California, we have 75% of all the plans that are on the California exchange are defined as having narrow networks. What does that mean? That you have very few doctors or hospitals or things that you can go see. And if you get into, say, an emergent situation, they take you to a hospital, and your doctor or anesthesiologist is not in network, guess what? All that is your own out-of-pocket costs. This is also showing you that this is tough for employers, too, that the large employers The average health plan is going to cost more than $14,000 per employee in 2008. And what are they turning around and doing with that? They're asking you, the workers, to contribute more of your paycheck each month towards your health insurance premiums. Not only that, are they taking money out each month to pay for your premiums, they're also asking you to pay more in terms of co-pays or deductibles. Meanwhile, your wages have remained stagnant. So when people talk about taxes of a single-payer system, we are paying taxes. These are taxes that you're not getting credit for. These are taxes that you're paying more on the back end for co-pays and deductibles and towards your premiums. And then let's just talk about drug prices for a minute. This is showing you that 73% of Americans think that prescription drug prices are unreasonable. This was a study that just came out showing that 45 million Americans reported last year that they went without getting their prescriptions filled because they couldn't afford them. 45 million. And then let's also talk about California. Healthcare is expensive, but to do nothing, California has a $77 billion healthcare retiree liability that's unfunded. And then this just came out last week. The California schools are facing a $24 billion healthcare retiree liability. And I'm sure each of your states and local governments are feeling the same thing. So that's the argument that I think each of us have to make to all of our local mayors and school boards and such. They need to get behind this because that's money that's being consumed that could be used to fix roads in their cities, to build schools, to buy computers, all of these things. But this is being consumed, and yet our legislators sit there as if everything's okay. And Medicaid, which has been tremendous in terms of expanding care, I will say in California, we are 48th out of 50 states in terms of physician reimbursement. So a lot of doctors don't see, a lot of my colleagues don't see Medicaid patients. And as a result, a lot of these patients, even though they quote have coverage, can't find a doctor to see them, and they present, in my case with cancer, later stage cancers when they come to see me. And we know that even if the Affordable Care Act doesn't pass, this is one thing that is going to be under assault. The eventual conversion of Medicaid into block grants, which will be devastating for our state and others. And Medicaid, let's just call it what it is. It is somewhat discriminatory. This is a lawsuit that was filed by MALDEF in the state of California because claiming that predominantly people of color who are on Medicaid are discriminated against because reimbursement is so bad. So if we keep our existing system, it's certainly better than what the Republicans had offered, but it is terrible still, and we can do so much better. So why are we getting so much and spending so much and getting so little? This is just showing you from 1970 to 2009. The red line is the number of physicians that were trained. The yellow is the number of administrators. And look at what happened to hospital costs, right? And what happened is hospitals, insurance companies started bringing on administrators with the idea that if we could just start denying more care, we could actually make more money. But in the long run, it's also inflated costs as well. And this is just showing you that when in 1970, we had the choice. Ted Kennedy was pushing for national health insurance. Richard Nixon countered with an HMO bill. And Canada went with a single-payer system. Look at what happened between Canada's costs and our costs since that period of time. Doctors have it difficult too. This is just showing you that the average doctor's office spends about $68,000 annually fighting for co-pays, deductibles, pre-authorization, and they're spending a lot of time doing paperwork. And as a result, we have the least efficient healthcare system of any industrialized nation. We spend more time on non-patient care related things that are consuming more and more of our dollars. And it's gotten so bad that now, for the first time, doctors at a poll, the majority of doctors are in favor of single payer. And the medical students, who are amazing, because think about it, why would you want to go to a school, pay $250,000 worth of debt, graduate in something that is so bad right now to practice in, unless you really had the best intentions? And these waves of medical students really are doing it for the right reasons, and universally are all behind single payer. So if we really try to diagnose the problem of our healthcare system, it's we have a large parasite in our healthcare system, which is called the insurance industry. So one of the things I would just say is, Thomas Edison said, if there's a way to do it better, find it. And this is 1965, that's me and my dad. but it's also, I was born about 3 weeks before Medicare was signed into law. And one of the things I just spend a few more minutes is that Medicare, despite taking care of an older, sicker population, has done a much better job of controlling costs and patient satisfaction and care compared to the private insurance industry. So when you hear that the government is incapable of doing things, it's simply not true. Healthcare, we've done consistently better now for over 50 years compared to the private sector. Just to point out that Medicare could be even better if Congress was not deliberately undermining it. This is showing you that Medicare Part D, which was passed by a Republican House, Senate, and signed into law by President Bush, forbid Medicare from negotiating drug prices. And if you look at the combined profit since Medicare Part D has been signed into law, you can see it's gone up. Medicare, the cost, specialty drugs are consuming more and more of Medicare's budget, and they're turning around and using this money to lobby. And this is showing you what the CEOs of the big pharmaceutical industries are making as well. Now, I got myself into a lot of trouble about 16 months ago. And I'm not going to reiterate what I said, except to say this. If any of you were offended, I do deeply apologize to each and every one of you. It was definitely a learning experience and a humbling experience for me. But what happened, let me just explain two things. So after this happened, 3 weeks later, President Clinton called my wife to say that he and the secretary actually watched my speech, and they realized I was not talking about the secretary. They were not going to make anything public about that. He also went as far as to recount his own battle with Congress and say it really was when he and the secretary were trying to do health care reform, it was actually the moderate Democrats who were giving him the hardest time, not the Republicans. But what I said was that as long as we don't have a president who aspires for something greater, we'll never get single payer. As long as we have a Congress that is beholden to corporate interests and continue to do the bidding of the insurance and private insurance industry, we will never have Medicare for all as well. That's right. And let me just point something out. So Senator Sanders introduced an amendment a few months ago to allow the importation of drugs from Canada. And 12 Republicans actually voted for it, but 13 Democrats voted against it. And these are the 13 Democrats and how much money they got from the private pharmaceutical industry. Right? So, and then, as far as with Senator Sanders' bill, it said Democrat holdouts on Medicare for All have received twice as much insurance industry cash as sponsors. So I'm not saying the word I used was smart, but it wasn't wrong either. And in the end, this is what we need to do. We need to not only resist corporate Democrats, we need to vote them the hell out of them. All right, promise, home stretch. So I just want to say this. We are moving to single payer one way or another. Either through rapid consolidation and mergers. You know, the insurance industry sees the benefits of single payer as well, except passing any savings on to us, it's not going to happen. It's going to go to shareholders. Peter Lee, who is the director of Covered California, he did the unusual step of posting an editorial in the Wall Street Journal defending mergers. He said that he felt the merger with Cigna and Aetna. He said policymakers should consider the potential benefits of industry consolidation, the greater efficiency and market power of larger insurance plans to lower prices. Sounds like he's making an argument for single payer. So, as you know, there are 3 bills. There's HR 676, which, I'm sorry, this is an old slide, but there's actually now 121 sponsors. Don Beyer signed on to it yesterday or the day before. And we have Senator Sanders' bill and SB 562. I'm really not going to go into the details of all of that. I assume somebody else will do that during this. But I want to point out a few things. Like marriage equality, the public sentiment of government-run healthcare has exponentially changed. And now the Pew Research poll showed 60% of people support single payer. This was The Economist showing that 75% of Democrats, 58% of independents, and even 46% of Republicans favor single payer. In California, we ran several polls that showed 70% support for SB 562. And recently you saw Senator Kamala Harris, who was the first senator to come out and co-sponsor single payer. And one of the things that I will say is people are like, well, it's political, why is she doing it? Of course, everything that our politicians do is political. Yes. But what's changed? What is it that now they no longer view this as a social taboo and are saying I support in principle, but are willing to co-sponsor and put their name on it?
Because people.
It's us, exactly. As you know, Senator Sanders in 2013 had no co-sponsors, now he has 16. And I just want to point out some of the longtime people here. Here's Tim Carpenter on the right, who some of you know, who was the late Tim Carpenter. I met Michael Leidy when I first moved to California about 10 years ago, and he's been an inspiration to me and a mentor. And then I want to especially thank the nurses.
I'm recording it.
I have to say this. I am, I'm a physician, but I've always made the joke that I'd rather be part of CNA than CMA, which is the medical association. But I just want to say this. At a time when you have received tremendous backlash, had your motives questioned, you guys have stood strong. You guys have been the heart and soul of this movement. You've been the driving force, even when times when many of us have been frustrated, and I just want to say you guys have been tremendous on this. But I also want to show some other pictures. This was Sheila Kuehl's bill back in SB 840. Up in the right, you have people that were going to get thrown out of Max Baucus's hearing and arrested. You have David Himmelstein, who is the head of PNHP. But here's what's changed. For the first time, you see young people, you see people of color, you see people of different religions and nationalities coming together to fight for something greater. And this is why I think the movement is resonating now, and maybe it didn't resonate a few years ago. This is showing you the turnout we get at marches. We've never, sometimes it'd be hard to get a few people to show up. Now you get thousands of people showing up in downtown Los Angeles to march for Medicare for All. It's changing, and this is why our politicians can no longer bury their heads in the sand and continue to do the bidding of the private insurance industry and the pharmaceutical industry. They feel it, they feel the pressure, and that's what I would encourage each and every one of you to continue keeping up the fight. Last argument you're going to hear is, we can't afford it, we can't pay for it. So the Urban Institute, which was, I think, kind of put forward to savage Senator Sanders' presidential Medicare for All bill, they estimated the cost of it being $32 trillion. We know it was far cheaper than that. But the current budget analysis shows that without doing anything, we're going to spend $49 trillion. So you do the math in terms of, quote, what is fiscally responsible? This is also showing that the tax cuts and wars account for nearly half of our public debt, but no one ever questions this at all, right? And we spent $16 trillion to bail out the banks in 2008. You mean to tell me that we couldn't have used that $16 trillion for better use to give everyone health care, which would have caused much more economic stability in our country? And our Senate just passed an $80 billion defense spending increase. And sadly, it was almost every Democrat that voted for that as well. So when you hear these corporate Dems say we can't afford health care, call them out. They're not fiscally responsible. They're fiscally hypocritical. That's right. Yeah. Finally, with SB 562, people will say that it costs $400 billion as if we're not spending anything right now. We are spending $368 billion. Single payer would bring us down to $331 billion. And one of the things you hear is that it was woefully incomplete. There was no funding mechanism. Well, the same state assembly passed an electric car rebate program, but there was no funding in it. And it said, even some supporters admit this is not fully cooked. So the idea that something woefully incomplete could pass our assembly, it happens every day. Finally, the idea that this is a pony that we can't have. Look at all the countries that have ponies. So where's our freaking pony? Very last one. I just want to conclude by something with, I'm wearing a t-shirt of the late, great Shirley Chisholm. She ran for Congress in 1972. She actually, before she ran for Congress, ran a bunch of inner city preschools and gave my mom her first job after my mom graduated, and actually got my mom her green card. But Ms. Chisholm said this back in 1972 when she ran for president. "We have never seen health as a right. It has been conceived as a privilege, available only to those who can afford it. This is the real reason the American healthcare system is in such a scandalous state." Could have been said yesterday. But it's time that all of us are working together, and it is going to happen. It's going to change, and thank you so much for all you do.
Thank you, Paul. That was wonderful. Let me introduce you now to Congresswoman Dina Titus.